track a little bit here. In terms of the key, because obviously they're not just rhinoplasty surgeons listening to the podcast, quite a few patients also do. What are your big take-home messages for patients who are considering a rhinoplasty?
Very good question. Really good question. You look at the websites out there and they say, make sure your surgeon's done X number of this and make sure they're, of this on these organizations and so on. I guess that's better than nothing, but I think patients, it's hard, but I think a patient needs to sit down and really work out, number one, as much as language allows, for them to put into words what they're trying to achieve physically, cosmetically. Because I understand it, but if a patient says, look, you choose or you tell me what looks right, that's not a good thing. A patient's got to understand what it is they don't like. And they've got to be able to articulate it so that we can understand. Now, image manipulation is very helpful as a tool, but they've had to work out in their own mind what it is they don't like and want to achieve. I think they've then got to be confident that we're on the same page as they are. So that means intelligent listening on our part, not just, yeah, sure, in you come. We really have to listen. And there are times when I'll advise patients against surgery, not because I don't think I can make the nose look better, but because I don't think I can make it look better in the way they want it to look better. So I think it's so important we've heard what they say, and that requires skill and performance values, if you like. And then I think, is the surgeon honest? Are they transparent? Have they told you about risk? Have they said that past performance is not a guarantee of their result? So I think feeding that there's a good relationship and good communication is vitally important. I don't think numbers is necessarily such an important game. Yes, because, well, coming back to it, if we again talk about sporting analogies, a lot is made of purposeful practice. So you do your 10,000 hours and then you do purposeful practice so that you recognize what it is that needs to be worked on and you just keep pushing and pushing. So it's just beyond reach and then you get there and then the next one. The trouble with rhinoplasty is that it's what the psychologists call a wicked environment rather than a kind environment, so that it's not like swinging a golf club, that there is a way to do it. And if you could only just do it that one way, you'd always hit the ball straight down the middle, 250 yards, 300 yards. There are so many variables in rhinoplasty that just thinking I can do another and another and another and get the numbers up is not the same as that purposeful practice thing. So a lot of people say, well, how many have you done and do you do this? I'm not sure that's necessarily so helpful. It's difficult though, isn't it? Because these aren't black and white things. People like certainty and people like black and white. And they say to me, how confident are you that it's going to turn out like this? Now, if you're an honest guy, you say, I'm confident that I know how to do it. And I'm confident that it's the right approach for you. But I can't tell you that it's definitely going to work out like that because I can't control everything. So they want your confidence. But if you're honest, you're going to say, I cannot guarantee it. And that's a tough one for a patient. And they may have well seen someone else who says, yeah, no problem, I can definitely get that for you. And then how do they choose? It's really difficult.
No, but
I guess in the end, you just have to be yourself. And then the patient, you're either a good fit for that patient or you're not, really.
Yeah. So one of the things I think in London, surely it's like a melting pot of cultures. You must see the entire spectrum of different ethnicities come across into your room. I mean, that just purely, forget about everything, it's just the skill of rhinoplasty and the difference between an Asian, maybe a Caucasian, and Metis, an African. There's a whole lot of different noses. Do you do the whole rainbow of people who come in?
I would say that the Oriental Asian population is not currently that big in the UK. So if I see a patient who's Korean, Japanese, Chinese, generally speaking, unless it's a small specific change they want, I would usually say, do you know, I'm not the right guy for you. And so I would say that. I don't have a big experience in the Black patient population. But again, one has to be really careful because Africa is a huge country with a huge, you can't say this is what you do. Again, it's that reductionist left brain thing. You can't say this is the right technique for an African rhinoplasty because it's just naive. I think it's very difficult for patients because, there might be somebody who looks at Beyonce and thinks, well, Beyonce's got a small nose and she's a Black girl. Therefore, why can't you give me that nose? And so you have to be careful and explain it's not, that's an oversimplification. But I think one way or another in the UK, we certainly have I have a big part of my practice is Indian subcontinent rhinoplasty patients. And again, every patient on their own merits, because I gave a talk once on ethnic rhinoplasty, and basically I said it's such an unhelpful term. There are 6,000 ethnic groups or so in India, and a Northern Indian patient may have a completely different set of anatomical features than a Southern Indian patient. So again, it's understanding what that patient wants and working out what's possible for them. So again, I don't think it's that helpful, really. We can point out certain things to a patient. You've got thick skin, or if you're Northern European and you're fair hair, redheaded, pale skinned girl from Ireland, you've got very thin skin, and so there are pros and cons. But again, I don't think ethnic groups are particularly helpful, really. But yes, there's a vast array of different noses that we have to help with. Yeah.
Okay. Another question. Advice for the beginners listening to the podcast. Just a sentence, even that.
I'm pausing, aren't I? Because it's difficult just to give a sentence. I think before you even start, recognize that getting good results and getting consistently good results is really difficult. So if you're not prepared for, well, certainly this is my experience, but if you're not prepared for having to really think hard, if you're not prepared for setbacks, it's not the right thing for you to do. It is millimeter surgery because, it might look millimeter right in two particular planes of view, but if it's a millimeter out in the third plane of view and you didn't see it on the table, because you don't always, it's going to show up afterwards. I think also be prepared that that patients, quite honestly, you're operating on patients' faces, and there's a significant psychological responsibility to take on there, because if it doesn't work out, you can really upset someone who's vulnerable, and that's difficult as well. It's why I arrange for every patient I see to see a clinical psychologist, and it's not just any clinical psychologist. It's clinical psychologists I work with and talk with every day. In the UK, the General Medical Council and the College of Surgeons and the British Association of BARPS, the British Association of Aesthetic Plastic Surgeons, says that every patient who's considering aesthetic surgery, not just rhinoplasty, should have a psychological assessment. Well, I think, okay, if that's the case, then they should have the best psychological assessment. And whilst I have obviously an understanding of psychological assessment and antennae that are sensitized after 20, 30 years of doing this, the patient should see the best. And that's why I arrange for them to have that psychological assessment performed by a clinical psychologist. And then we talk together afterwards.
That is so interesting. So, okay, so if a patient's now making the appointment, or currently through COVID, it's a Zoom appointment, is one of the insistence you have to go and see this person? Because, that's, to me, it's almost a little bit of uncomfortableness of saying, okay, does that mean both functional and aesthetic rhinoplasties, or any rhinoplasty across the board? If you want to get operated by Julian Rowe-Jones, you're going to be seeing a psychologist first?
If it's pure function, then no. But again, you have